There's going to be a Q&A that happens. It'll be in our chat form. We have a number of staff who are also connected on here that will be answering some of your questions as we go along. If we have time at the end, we'll pop on and try and answer some of those questions. And so I'm going to turn it over first to the CEO of the mission, Peter Tilley. Peter, you've got quite a crisis on our hands in this city, and certainly the population that comes to the mission is really at risk. And so maybe just explain to us, how you're coping and how things are going at the mission today.
Well, that's a great question, Sean, and our thanks to our supporters, our donors, and many others who have chosen to join us today. I'm glad to see Chef Rick and Jesse Wynack with us. So if I get stumped, by all means, I know that the B team's going to jump in and the bullpen answer some questions. But you raised a great question, because that's a question we're getting asked by so many: is how is the mission coping? How are the homeless dealing with this COVID-19 situation that's upon us? And boy, like everyone else, what a difference a month makes in the way we do everything. So at a homeless shelter, as we know, it was never an option to close our doors, never an option that we could shut down operations. Our population needs us more than ever before at a time like this. So we've had to be there for our people. We've had to be there as a part of this community, working with our other partners in the city, which I'll highlight a bit later. But we've had to continue to provide the services we provide to our people. But that being said, we've had to look at rewriting the whole book on how those services are going to be provided. And it's a daily rewriting of that book sometimes, as we look at some of enhancing our cleaning services, enhancing our frontline services, so people who enter the shelter are immediately hand sanitized. Looking at things with our frontline staff, enforcing physical distancing amongst our population. As Chef Rick knows, setting up the kitchen line and the way we deliver food service in a totally new model to practice social distancing and also protect the staff, who in turn protects the clients when they come into the building. So everything has changed here at the Ottawa Mission, but we can assure our supporters that we're continuing to deliver a vital service to our clientele at this time.
You mentioned that there's a variety of services. If any of the services that we provide, have we suspended any at the moment, or anything currently on hold?
Yes, unfortunately, that is the reality of this new world order that we're dealing with, Sean. And as you know, you've been a big part of helping us with some of this, getting the message out on that. Certainly our client services, that the drop-in center client services, those have had to be suspended, but we've moved some of the client service workers over to this side, the core of the building, so they can support the frontline staff in dealing with clients who are anxious, clients dealing with mental health concerns. That team has moved into the core and working with the frontline a little more closely to address suddenly those more crisis critical needs. And that our day program, one of the things that really touched my heart is early on we had no choice but to suspend our addictions day program, that successful catchment area where people first come in to learn about the journey to abstinence. That was a gathering of 35 to 40 people in the chapel every day. We just couldn't be having groups together like that, of course, in today's environment. The other one several weeks ago was that really touched us all, was the suspending of our chapel service, our 11 a.m. chapel service, one that you've conducted several times yourself, Sean. So that was hard on us all as well too. Our client educational, job training programs, social activities that we do here, to try and bring enjoyment to the clientele. All those have had to go. Why? Because we've had to minimize the risk of infection amongst our population. That has been our priority: prevention, prevention, prevention. So it's unfortunate when we have to make choices like that, but we've had no choice.
Absolutely. People can ask, has COVID-19 surfaced itself within the mission, within the homeless population, or even with our frontline people that offer services?
Pardon me, sorry, I didn't catch the first part of that, Sean. It's just, have we seen any cases, were you asking? Or?
Yeah.
Yeah, so for all those people who keep reaching out to us and telling us they're praying for us and they're praying for our people, keep that happening because it seems to be working. And I'm delighted to report that as of this call, to my knowledge, there have been no positive diagnosis of somebody with COVID-19 amongst our population, not just at the mission, but at all the other shelters as well too. So that's a miracle when you look at our vulnerable population, and we're going to keep being vigilant in all we do to limit that possibility. Some say it's when, not if, but we're still working on the if and doing all we can to prevent that. Thanks to many heroes here amongst the staff team who are making that happen.
Yeah. You know, we often hear the stats, whether we follow John Hopkins or we turn on the nightly news, but there's people behind all this. And what's the morale of the guys who and women who come either to our meals or the men who come and stay at the what's the morale of those who come our way?
So definitely at first, Sean, it was a lot of anxiety. People don't realize it, but the homeless population are news junkies. We have a lot of people who really know what's happening out in the news, whether it's a local election or a provincial election or whether it's what's happening. So when this broke, that this was no longer a global issue, that this pandemic had spread to the city of Ottawa, was now in Canada. That was about 3.5, 4 weeks ago when this first really hit the Ottawa scene. There was a lot of panic amongst our population, but again, our great client service, frontline team, working with the people, even our Jesse's team who walk the halls, calming people. And I go out, I'm careful to physical distance, I'm careful to wear a mask, but I was out this morning, I was out Friday morning, and there seems to be a calm that's settled over some of the clients who are here. And one of them on Friday morning told me, and there was a group around and they all agreed, that he said he feels safer here than he does in many other places. He looks at what we've put in place, the protocols we've put in place. First of all, how quiet the shelter is compared to how it normally is. It's not as active as it usually is. And he just said he feels safe here at the Ottawa Mission, and that was very reassuring.
That's excellent, excellent. Media's covering lots of funding announcements. I think 156 million to the homeless population across Canada. I think there was a $5+ million announcement for those in Ottawa who deal with homeless. How do you see that impacting our work?
So we did apply for some of the federal funding, as you're aware, and we received half of what we had asked for, and that hopefully is the first envelope in others yet to come. We're not certain about that. So we did apply for, because we've had our primary cost increases have been the increase of staffing in the cleaning and housekeeping area, as well as the frontline area, plus a lot of adjustments to the way we do things around the clock now. So there's been some challenges there. So we did receive some funding, and I think obviously as the executive director of the foundation yourself is aware, we've had a great public response too. So we're putting that call out, as you well know, to our funders, to our supporters, that we are incurring exceptional costs at this time. We don't know what the future will hold, but we do know what the present holds, and that's certainly an increase in our activities to be vigilant in what we do here.
Good. We're gonna come back to you in a minute, but I'm gonna turn over to our very own Chef Rick Watson, one of the Order of Ottawa's newest recipients. His work in this community is incredible. He leads an incredible team. And I thought it would be good for our donors and volunteers just to get a sense of, how is food services happening at the mission in this climate?
Yeah, food services is totally a different world here at the Ottawa Mission, but we're still managing to make it happen. We're still feeding 3 meals a day to our clients, our resident clients. It takes a lot longer because we're practicing social distancing. So instead of having a lineup come through to pick up their meal in the servery area, we actually only have a few at a time. And we've taken some tables out of the dining room, and instead of having 8 people sit at a table, we have 4 sit at a table. Instead of having that personal kind of touch, we now have a plexiglass window between the serving staff, so the staff and volunteers, and the clients. So that has totally changed. But you know what? One thing I can say is the clients are thankful that we're here for them and they appreciate it. And for our community meals, we're actually, so no community members or no community meals are served inside the mission. They're served passed out through our entrance on Besseur. And there's a lineup every day. I just finished doing the service today, 1 o'clock. We have a lineup all the way down around on Cumberland. And we pass 2 meals out a day, plus a bag of groceries. It could be produce or it could be just canned goods, but stuff so these people can get by. And I've had people in tears thanking us for still being able to do that. And, you know, my heart's with these people.
Yeah. Just shows, you know, in a time like this, our mission does not, and we need to find ways in all that we can to deliver the services to people the best we can.
Absolutely.
I know I've been in your kitchen often, and there's a number of volunteers that make it happen. How are volunteers being engaged right now within your kitchen?
Well, before this happened, volunteers made up 2/3 of our workforce in the kitchen. So we had 25 to 30 plus volunteers every day. Some days, well, most days I'm serving at least 1 meal a day because we don't have enough volunteers. Practicing social distancing in our kitchen is almost impossible. It's a small area. So we're trying to reduce the number of people we have, the staff and volunteers. But yeah, it's been a real tough situation for sure.
Any concerns that you have with supply chain? I know when we talk about food and it moving, you feel good with the supply chain to meet the need?
I'm not feeling very good about it. When this first started, we had a lot of, as you know, the city had a lot of restaurants and hotels and things closed down. So we had huge donations coming in. That has stopped. So now we're experiencing the increase in prices already. Also, you know, I've talked to some of our suppliers and they say, well, if you want this product, you better order a lot of it because we may not have it next week. So it is a big issue, Sean, for sure.
We know as we have this conversation, we sit in the midst of Holy Week, and as a faith-based organization, you know, we just honor this week as we come through Palm Sunday, we come into Good Friday, and you know, usually at Easter time, we celebrate a big Easter meal. We have 25 to 3,000 meals that are served that day. How is this Easter going to look different than previous Easters?
It's certainly going to be different, but with the support of the whole senior management team and all the mission we've managed to put together for our residents, we're going to have a nice Easter dinner for them, you know, with roast beef and Yorkshire pudding, something really nice. And for our community guys, we're going to be doing handout, takeout meals with the same meal and make it extra special nice. Time and again, catering is supplying a special dessert, and you know, some other organizations are supplying some nice things. So we're going to make it as nice as we can. It will not be 2,500 to 3,000 people for sure, but it'll certainly be a good meal and put a lot of smiles on faces.
That's awesome, Chef. We certainly appreciate all the work that you do, and your work is made possible because of the donors on this call that, you know, send in their placemats or their different things to support the work that you do each and every day. So we thank you.
Absolutely. We couldn't do it without those donors for sure.
We were hoping to have Lynn Landis on our phone call. She's the Director of Health Services, but she was called away to a government meeting. So we're going to serve up some of these questions to Peter. And, you know, one of the questions is, how are we helping to identify and deal with clients who may exhibit symptoms of the COVID virus?
Well, you're right, Sean. Kudos to Lynn Landis, our excellent Director of Health Services, who moved to the forefront in partnership with Shepherds of Good Hope and Wendy Muckle from Inner City Health in dealing with Ottawa Public Health. So yes, we found out she had to bow out. So she's been keeping us all well abreast of what she's up to. So I was well aware this past weekend by Joe McLean, our Director of Programs. She informed me of a situation. So we have the protocol set up, and it was great to see the system working when I was informed on Saturday by a call from Joe, as she had the frontline manager, McKell, informed her that 2 people had complained of symptoms of COVID-19. Those people were immediately isolated to dorm rooms where by themselves and put in those dorm rooms. Jesse's excellent team immediately began to clean. both the washrooms that they had been in, the hallways they had been in, any area that they had been exposed to, while we waited for an assessment van. So Ottawa Inner City Health has converted their mobile van, their health unit, to solely a COVID-19 focused assessment van, and they were immediately on the call to come to the shelter. Those individuals were then brought down to be assessed and then brought to the isolation center that we set up at Luce, where they waited their test results, which took several days. Fortunately, both results came back negative. But in the meantime, the frontline staff had donned their protective equipment, their PPE, and had calmed the clients down when it first began. And of course, it was great that Joe and I were informed at all times that we had a possible case of COVID-19. The other piece that impressed me so much is Mikkel was immediately on the cameras and in conversation with the clients and with the frontline team to trace the steps back of those people who were complaining of symptoms. So immediately we had learned that a few days before, one of them had been with us. He had left and now returned a few days later, but he had been in a dorm room with 3 other people in one of the dorm rooms of 4. Immediately we contacted those people to see if they were complaining that they had any symptoms. Now, as it turned out, again, the tests were negative. A celebration there for all of us when that happens, but certainly the processes are in place. And in this case, we got to do a test run and it actually worked. So a relief for us all when that happens that way.
Yeah, because it is so true that the population that you serve, they're much more vulnerable than the general public.
Yes, that's a good point, Sean, is we're dealing with a group of people who have spent many years of their lives living on the streets, living in homeless shelters, making poor choices often along the way. So these people are often, their health systems are compromised. And then we add that many of them are suffer from anxiety or other mental health issues. So even when they're feeling that way, they may have anxiety about going to our health clinic, about going to see someone to mention their symptoms. They may be so used to having colds or flus or fevers that they think it's just another one. So we've put up signage in the buildings. We've got the frontline speaking and the client service workers speaking with people on a regular basis, touching in, being vigilant to make sure that we're checking all times and people are aware at all times. Are you losing your senses such as taste or smell? Are you feeling aches and pains to the joints? Is a fever developing? All those early symptoms, we're being very vigilant in explaining these to the clients. And that's why some do identify, I think I need to be tested, and we're on that right away. But definitely a vulnerable population, people who are used to catching colds and flus and fevers. So we realize what's on hand here is our duty to protect these people.
At lunchtime, I was listening to CBC and they were talking about long-term care facilities. And that reminded me of our hospice and the vulnerable population. Oh. How has that impacted our work within our 23-bed hospice?
Well, that's right, Sean. People don't realize we have one of the largest hospices in Canada, and it's a hospice for the homeless, thanks to my predecessor, Diane Morrison's vision that we needed to provide palliative care for the homeless, that people could go to have a place to pass on with health and with dignity. And one of the toughest decisions we had to make early on, and it's odd how within a 24-hour period, we went from limiting to reducing to eliminating visits to the hospice. And we just had no choice. And that was a decision that was made right in the initial stages 3 weeks ago. So a tough decision, because many of the people in the hospice have 2 or 3 or 4 months to live. And now we were going to be informing them that your friends and family cannot come to visit you in these latter days of your life. But it was the right decision. Sometimes it's not always the easiest decision, but in this case, it was the right decision. And we're responding now to set up virtual FaceTime meetings with their family where possible. Our chaplain, Timothy, is regularly checking in with people virtually, FaceTiming as well too. So very hard to make a decision like that, but you've highlighted what's happening in the long-term residences, so a necessary decision.
Yeah. There's about 150 plus people on this call, so I just want to remind you, if you have a question, there's a chat that you can use, and we'll try and get those questions either answered online, or someone will text me the question if we have time, and I'll bring it to one of the guys here who are on the screen. One other question to you, Peter. The mission can't solve this on their own. We're part of a network. How are we working with other organizations to help?
That's a great question, Sean. So as some of our supporters may not be aware, it's not just been the Ottawa mission. Right from the start, we were taking our lead, the direction from Ottawa Inner City Health and Wendy Muckle, Dr. Turnbull, now that he's retired as Chief of Staff from the Ottawa Hospital. What an addition he's been to have somebody like that during a crisis like this. And Ottawa Public Health, we've seen the leadership of Dr. Vera Etches. So we've been counting on them to take the lead, and we've been working, Sunday afternoon, evening calls with my peers, Deirdre Freiheit from the Shepherds of Good Hope, Mark Provo from the Salvation Army, and Kia Rainbow from Cornerstone Women's Center. So we've all been in partnership, and plus about 7 or 8 other smaller organizations, regular calls with the City of Ottawa, and I have to highlight the leadership of the City Housing Department there too. So very fortunate, all these partners working together. But in the early stages, we certainly knew we were vulnerable as this hit us, and as this situation hit us, and certainly turning to the leadership of Ottawa Inner City Health and Ottawa Public Health for direction. And now that's been implemented, and of course, it keeps changing every day as we learn more about this horrible COVID-19 epidemic, pandemic. So we're continuing to change our processes as need be.
There's an old saying that cleanliness is next to godliness, and that couldn't be truer as we go through a pandemic. And we got the manager of housekeeping services, Jesse Wynot, with us, and he leads an incredible team that just every night the beds are washed, the sheets are washed, and just a cleaning that is deep and thorough throughout the organization to keep everyone safe. So Jesse, I'm just wondering, what measures are in place from your team to make sure that the mission is as safe as it possibly can be?
Thanks, Sean. Before COVID-19, we did a lot of our cleaning daily. So we go through the whole building, dorms, kitchen, bathrooms, lounges, hallways, offices, chapels, once a day, give it a good cleaning. All the beds were changed once a day, washed, dried, and folded, and returned to the clients. But since then, we do an outside round as well once a day. But since then, we're stepped that up big time. So we're cleaning the shelter fully at least twice a day, some areas 3-4 times a day. Any of my staff's extra time, they're out there with their Oxivir bottles, disinfecting all touch areas throughout the staff areas, common areas, client areas. And we've increased our outside cleanups 2 or 3 times a day as well to remove threats like cigarette butts, paper cups, transfer COVID-19.
Awesome. What keeps you awake at night? What are some of your challenges as you try and make sure that the mission is as sterile and as free of risk?
The biggest thing for me is keeping staff safe so they continue to come in and do what they do to help the clients that we serve. And again, with our space constraints, it's been hard to practice the social distancing, but we've taken measures in place such as staggering meal times, like Chef said, reducing the number of people per table. We have marks in the floors in our lounge and our chapel to keep the chairs in place so we have enough room for people. We've opened our chapel as a secondary lounge to provide more space for people to spread out. And again, all the staff is using personal protective equipment, including gowns, face masks, goggles, gloves, and those are being maintained here as well. And again, like I said, we increased our disinfection control all over the place, as well as a lot of outside rounds.
Good. Yeah, like we've heard and we see each day how important, your team is in the front line to make sure that, those who have to turn our way can be certain that we're doing all we can to provide a safe environment for them to receive services. And so we thank you. We thank your team for all that you continue to do. And we'll maybe, hopefully this ends sooner than later, but maybe we'll pop back in a couple of weeks and see where things are at. We're going to wrap up here shortly, but Peter, people often want to give. they want to give things, gift in kind. Are we still taking those, or how is that working?
Well, I think, Sean, we've sort of asked people to appreciate the risk factor that's involved with any gifts in kind, such as drop-offs of food, drop-offs of clothing. We just had someone who was puzzled yesterday over the fact that we weren't accepting clothes, and we had to explain that we're still trying to get a handle on how this virus spreads. But more than that is just the face-to-face that has to occur with someone who's dropping off clothing with the staff and somebody coming in. So I think the best solution for people that want to help, and it's our immediate need, and you as the executive director of the foundation know this more than anyone, is how we can turn that dollar into addressing the critical needs at this moment. So people can make a monetary donation. They can go to ottawamission.com /donate and help out that way. Just go to the website, ottawamission.com, and we'll steer them through it. They can read information on our response to COVID-19. Certainly, I'm stealing a bit of your thunder there, Mr. Wong, as I say that. Sean, I just wanted to highlight quickly, too, I know we're pressed for time, but the above and beyond in supporting this community of these two heroes we have on, Chef Rick immediately stepped to the forefront that we could provide the food, the Ottawa Mission. We had to, of course, temporarily postpone the food services training program because the students would have been enclosed in a group, but Chef still volunteered to step forward, and we are providing all the meals for the Ottawa Inner City Health and city-run Routier Community Isolation Center that we've set up. And Mr. Wynock, I have to give him a shout out that in this time that we're out of face masks, Jesse and Ajit, one of his housekeeping staff, were down in the basement a few days ago, and they actually found a way to design the headbands with the plastic shields, and they put together 40 of those in the course of a day and immediately shipped them over to Ottawa Inner City Health. And I was fortunate to be on the call the next day to hear the gratitude of those in the community who received those. Jesse, congratulations. So kudos to you guys for going above and beyond. It's just one way the mission helps out the community. Okay, back to your question on people helping out, or I didn't know if you wanted to mention something further yourself.
No. Maybe just one other question. I was on a call with a bunch of heads of organizations this week, and the consensus amongst them all is that the increase for services expands, and yet the resources to deal with them begins to shrink. And even as we look into the months ahead, how are we pivoting to make sure that we meet the need that will come our way?
Well, that's great foresight, Sean. Our worry, and I know it's your worry too, and we've discussed this, is that people will respond to the immediate need. But even if we level the playing field, if we level the way things are working now, if we can flatten that curve, as everybody says, we're all going to be left to pick up the pieces. For a foundation, the obvious concern, are donors going to be in a position to give as they once were? So I think we're going to have to continue to highlight the work we're doing and stress the need in the community, and just let people know that it's a crisis situation, but at this time, if they can just find a way to dig down and give a little more, the old widow's mite, we can certainly need that more than we ever have before. That term gets so used. Your donation is needed more than ever before, as you and I know, but boy, your donation is needed more than ever before. It's a hard time right now. And that's just the present, let alone what the future has to hold.
Absolutely. I want to thank you, gentlemen, for giving up your time. I know you are all just outside of the spaces that you lead, and your teams are surrounding you. And so I thank you for the time that you've given us today. And I speak to all you donors and volunteers. There's over 150 some of you on the call. And, from our heart to yours, we want to thank you for this. Your contributions, either in financially or in your time. We know that the mission does not exist without you. And, every day we see how your gifts and your support support and your time are being put to incredible use to serve humanity. I heard someone say the other day, when's this going to get back to normal? And someone responded in a quote to say that life itself doesn't necessarily going to return to normal, but we've been given this opportunity to stitch a new garment that covers all of humanity. And I think as we look to the future, we want to ensure that the mission is available, is leading the way in delivering the services that we can to our community. And on behalf of that, I thank you. In this Easter season, I say God bless. The story of redemption and God's love will continue at the Ottawa Mission as we make our way through this. So I thank each one of you.
Thank you, Sean. Well said.
Thank you.
Thanks, Sean.